Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
First, treatment of open fractures. So, in the treatment of open fractures, right? In the treatment of open fracture is the fracture where the fracture site opens to the external environment and thus the hematoma drains from the wound. Through the wound, the blood starts draining from the wound in open fracture. In open fracture, first and foremost, the first step is debridement should be done along with the in open fracture. Debridement with external fixation is the treatment of choice. If in any case, if closed reduction or open reduction with internal fixation is done, in such cases, because if internal fixation is done, so that means a metal is put inside the open fracture. Already the fracture is open, so it is exposed to the external environment. So if a metal is put, then this will increase the infection of the organism, and thus open fractures we do not do closed reduction or open reduction with internal fixation. So the treatment of choice is debridement with external fixation is the treatment of choice for open fractures.
thank you and thank you for watching.